friends. Welcome back after a good lunch, and try to make sure that you sleep well during the sessions. But I think you should try to keep awake as far as possible. What we are going to do is take you through the physician practice of obesity, which is a very less practiced area in prevention. And whether it's you basically, whether it's a internist or a endocrinologist, we try to, talk of reality and push up the patient. And I think there are multiple reasons for that. One is important reason is our Dr. R. Sharma, that almost 100% of the patients will fail. Even if they lose weight, they will gain back after some time. There are few patients who sustain. And actually, because those patients are able to sustain weight loss and get all kinds of benefits, I think it is worthwhile practicing obesity arthritis. Second thing is, if you look at the patients walking into your clinics, I am sure not every second patient, in fact, every 2 out of 3 or 3 out of 4 patients are either overweight or obese. And we just sit and do nothing about it. So it is very important to tune yourself to obesity practice and gear your clinics to do obesity practice. Now what I am going to take you through for the next 15 minutes is how to set up an obesity clinic. Setting up an obesity clinic actually does not need a rocket science. It's simple principles of obesity management that you have to put in place and have a coordinated practice, which helps in getting results. So first thing is, what is the need? Why should you have this practice? And I just mentioned every 2 or 3 out of 4 patients that you see are going to be obese. And based a lot of, it is an important health challenge. As a medical practitioner, we have a duty to recognize obesity and take it upward. Second thing is, if you're practicing, it also makes business sense. You are seeing obese patients on daily basis and you are doing nothing, you are losing revenue. Why not generate that revenue if you are practicing? So, first thing is, you have enough population among your patients who are obese and overweight, they need to be managed. And second thing is, you need to have proper space for that. You should tune your manpower, find your manpower for obesity management, and you should have some kind of record keeping because these are chronic patients. So any chronic care, you need to have follow-up and follow-up records will tell you how your patients are doing. To practice obesity, one of the important things is you have to set up a protocol. So you cannot have a ad hoc mechanism that this patient, obese patient level, this second obese patient level talks about different kind of obesity. So you have to set a protocol that this will be the standard of practice as far as these patients are concerned. And you can adopt any of the guidelines that are available. In fact, the World Obesity just issued a guideline. And you can take tips from that. Guidelines does not mean that it is binding on everybody. You can pick up 5 points, see what is doable in your practice, and use that. Then another important thing is that you should have a team. Because you can't spend all the time with the patient, and you need to have a qualified nutritionist. Maybe you can have an educator who can help patient, with small adjustments on daily basis or general healthcare tips, or do some psychotherapy, counseling, that is what the work helpful. And you have to customize care according to the patient requirements whenever it is required. Now, whenever we are talking of assessment of obesity, first thing is we have to define what is obesity. So obesity is defined as an excess of fat. And excess of fat is very difficult to measure and is very expensive to measure. Actually, if you want to measure fat, the gold standard is underwater weight or deuterium hydrogen liquid assessment. There is a technique which is required, but that is done only in the trial settings. What you need to do is practice either you need DEXA scan or MRI, which are again not easily available and they are very expensive. If you want to measure fat, So most of the time you are dependent on the survey methods, objective assessment of obesity, and objective assessment we all know involves measuring body weight and height and waist assessment. Based on that, you can actually define the risk level and classify a patient into overweight or obese. And you can easily calculate body mass index, waist ratio, or waist circumference. These should be important parameters to define your patient into overweight or obese class and plan a treatment strategy. Now, the important thing is you should have a proper base scale. Good number of times if you have severe obese patient, he will not be able to stand on a small, digital base scale. So you need to have a good, strong base scale with a proper platform. And some of the patients are, so disabled that they cannot climb up the scale also. So if you have a facilitated scale, something like the slope shown in this diagram, in this picture, that helps the patients to move up on the scale. Second thing is, do not keep your scale in open area where all the patients are sitting. Because patients who are overweight or obese do not want to weigh themselves in public. So it should be kept in a slightly isolated area where there is no embarrassment when the patient is weighing himself. And all you need is good weighing scale and a measurement tape. Now, measuring tape also needs to be standardized. So you have to have a non-stretchable, flexible measuring tape which measures at a constant stretch. So how do you do a constant stretch? When you are applying the tape, the standard method is that you apply a spring balance to one end of the tape and pull it at a force of 600 grams. So every time if you are doing that, you will be measuring with the same amount of stretch by the tape. But most of the tapes, like ones you have seen just now, these have spring mechanism. So you lock it on the other side and press the button till it stretches to the maximum. So again, the pressure applied is stabilized and you are practically measuring the correct waist circumference. You should apply proper techniques. Your staff should be trained on how to measure this circumference, at what level, how to use the tape. The tape has to be, you have to mark the top of Pyrex crest. The tape has to be put in a very exact horizontal plane and should not be going under the belly, otherwise you will be measuring wrong. This is the right way shown in this. There are fancy things like watt bars and body impedance, bioimpedance machines which are used for measuring fat, but those are not required in routine clinical practice. All you need is a good, weight scale. Now you get fancy weight scale which can transfer the weight to your, computer or phone also. And good number of times the patient is weighing himself alone. Patient comes back and tells you some, fallacious weight, incorrect weight, so that you don't tell him that you are not doing well or something. So they will try to hide. So best is the weight is measured when the patient is supervised by one of your staff, or you have a translating device which translates the exact weight to your computer. Bioelectric impedance machines are able to tell you the body fat and fat mass, but these are not standardized for Indian patients. They are not required in routine testing practice, but if you have them, you can use them as a tool to tell the patient, look, so much fat you have now, and after 2 months follow-up, you tell them again that you lost fat, motivate the patient. Most important thing is you have to have a comfortable environment in clinic. Your chair should be wide enough and sturdy enough to support a heavyweight patient, because good number of times you get patients either having overweight or obesity practice, you will see patients weighing 130, 150, 170 kg also. They are not able to sit on small chairs. You should have a proper examination table which is wide enough to make the patient comfortable if you have to make them lie and examine them. You should have motivational, things put up in your clinic, like this one, put against the weight scale that now I can. So you are, indirectly giving motivational messages. This is another one which I picked up from somewhere. Now, basic infrastructure, what you need is comfortable space, a slightly isolated space for measuring weight and basic circumference, and a counseling room. That's all about it. The most important thing is you have to have a dedicated team and coordination of work. And you will be the team leader as far as the team is concerned. And the keys to success is the level of motivation you have to treat those patients. Treating obesity requires a lot of patience. It's not an easy job. You have to talk to patients, you have to listen to them. You don't get results overnight, you have to follow them up for months together, sometimes years also. So you're very motivated, committed about managing these patients, and should have supportive organization structure also. Most frequently used drug clinical medical practice is the doctor himself. It is your word to these patients, which helps them follow up and comply with the treatments. Now, in office-based care, another important thing you have to keep in mind is that patient is the prime person in the whole story of healing. So, if the patient is not comfortable, you will not ever be able to get results. So, you have to understand the level of knowledge of this patient, understand the attitude this patient has towards his obesity, towards eating, towards his lifestyle, what kind of expectation he has come with. Is 140 kg and he thinks that he lose 25 kg in 3 months, then possibly he is going to be frustrated over the next 4 weeks to gain heat. You also have to see how depending this patient is, what level of motivation he has come with. Is it just that the friend is doing it, so he has also come? He's not motivated. There is no point taking celebration for it also. As a clinician, you will need a lot of time to, spend with the patients and with your team to work on these patients. For that, availability also is important, and some background training in policy management is always helpful. Nutritionists or educator, at times nutritionists develop as educator also, is one of the key persons in the team. And the right practice environment, you have to have a coordinated, integrated approach. You have to have supportive tools, which many of them are not required. But something like blood pressure equipment, you need to have a large cuff. The standard cuff is not going to work with these patients. You have to have a bigger wheel scale. You have to have enough measuring tapes. All these things are small tools, but they are important. And the availability of staff to support all this system. Now, nutritionists and educators are the vital link between doctor and patients, and they help to reinforce what you are advising to patients. They are also helpful in educating the patient and family on various aspects of obesity and also working as a support system for the patient. They are the main motivational force for the patients because they play a very important role in influencing the patient behavior. Most of the time, the patient will not call it. They will call the nutritionist or the educator for small things, and they will take moving handholding for these patients to go further on to weight loss. They are also very person in maintaining follow-up, and they are finding friendly guides in time of stress for these patients. So you should have good counseling room, which can be a nutritionist room, and you should have demo stuff on tables, on walls, which patient sees and understands these are important things. Shilpa showed the plate concept in the morning. And I think that concept is very important because you tell the patient to have, or train the patient to have a visual impression of what kind of food he's going to have from his plate, and what kind of plate is a healthy plate. You can have a lot of education planning which will help the patients in understanding the problem and managing it well with your advice, with the nutritionist advice and counseling. There are multiple factors which will be influencing the outcomes of your patients. Most important are the factors related to patients, but there are factors related to clinician, to the practice environment, and so on. And both sides have to work. Patient has to learn about the disease, to learn to live with the disease, to follow the diet, exercise, medication. He also should understand what kind of complications he can have have a prevent this complication, he has to learn to become a chronic patient and be patient about this management because it is going to take time. But as a professional, you have to have accurate knowledge, this training, what about managing obesity. Learn to cooperate with the patient. If you don't cooperate with the patient, patient doesn't come back. So we are usually impatient. Doctors are the most impatient people. Learn to change patient behavior according to the requirements of the patient so that the patient is comfortable. Learn what it is, how the patient feels about his problem. And also keep changing your role in management of the patient. This was study which tells a lot of things. This was a study of 24 patients who were consulted 3 experts in a basic level in normal setting. One of the experts was a doctor, the second was the third was the dietitian. The team gave them several important recommendations to follow. After the patient finished with the consultation, came back to the group. The patient was in the group. Most of the patients could not call more than 4 different patients. So 40% of the patients told that no recommendation has been given. 66% said that I do not learn anything new, I know all these things every time we are talking the same. So these are the common things which happen in clinics, but we don't think that it is happening in our own center. So it is very important good communication, skillful and empathetic physician, nutritionist, educator, patient communication is one of the key issues that will help you in having a good basic practice. You can use now technology, you can create WhatsApp groups, WhatsApp group of our patients. Every morning we send them regular updates. If there is a festival, we tell them what to eat and what not to eat during the festival. During the fasting phase, you can tell them what could be preferred foods. Some patient is traveling, you can keep guiding them during travel what to eat. You can tell them to use apps on phone to monitor their activity. We are regularly monitoring our patient activities by giving them kilometers. They have to get back in kilometer every week. See how much activity they are performing. You can have regular periodic follow-ups, or you can use the apps for follow-ups. So many things you can do now. So in nutshell, basic clinic should provide comprehensive approach in organizing infrastructure to basic management. Physicians should be trained and oriented in handling obesity as a disease and a measure as a factor. Nutritionists and educators should be trained in handling various aspects of obesity. The team supported by good infrastructure should be in place to provide comprehensive obesity management. And I think most important thing is, whenever we see a obese patient, it doesn't take half an hour or 1 hour to just measure weight, waist circumference, height, and tell the person, look, you are overweight and obese, you should be seeking advice. So I think identification of obesity and labeling obesity as a problem is the first step in running obesity practice. I would also like to invite you again for the Advanced Certificate Course program in Delhi,